This question states, a patient is scheduled for a sigmoidoscopy. Which of the following positions would be most appropriate for this procedure? So let's break down this word sigmoidoscopy. So you might recognize sigmoid as part of the sigmoid colon. So it's like part of the colon. And then oscopy. So scope means to look. So going down with a camera. So it's kind of like if you heard of a colonoscopy, they put a camera down the rectum to look at the colon. So colon, scope, look. So we need to determine which position would be best to perform a procedure like this. So let's look at the choices. So option A says the Sims position. And the Sims position is sort of like a side lie with a knee bent, leg out. They're like this, but they're on their side. So you have access to like the rectum to go in through the colon, and they're positioned in a way where you have like the side and you could get to their back and you could also see through their front. And this is in fact the position that is used for a colonoscopy, sigmoidoscopy, because you have easy access to everywhere you need to look and you can get your good views from that. So we could go with option A, but let's take a look at the other options. Option B is prone. And prone position is someone who's just lying flat on their stomach. So although if you're lying flat down, face down, you can have access to the rectum, the way that the camera works to get up and through where it needs to go, it's a better position to be on the side versus completely prone or flat down, face down. So we can eliminate option B. Option C is supine, which means that the person is the reverse of prone. They're laying flat on their back, face up. And that would not work because you wouldn't have access to where you need to go to view the colon. So we could eliminate option C. And then option D is the Fowler's position, which is sort of like an upright position, which similar to the supine, you would not have the access that you need in a position like this. So we can eliminate option D. So that leaves us with the choice we initially predicted, which is option A. The Sims position is the most appropriate choice for a sigmoidoscopy.